Hello, my name is Ada Taylor. I will be speaking to you today about hypertension management. This lesson is targeted to the Shadowville community, particularly for adults aged 30 and older. However, anyone diagnosed with hypertension can benefit from this information. The overall goal of this lesson is that at the end of this lesson, the learners will be able to understand normal range of blood pressure, recognize signs and symptoms of high blood pressure, understand risk factors and complications of high blood pressure, manage high blood pressure, and measure their blood pressure. Sub-objectives are: one, at the end of this lesson, the learner will be able to explain the effect of high blood pressure on the human body. Two, at the end of this lesson, the learner will be able to identify lifestyle modification that can lower blood pressure. And three, at the end of this lesson, the learner will be able to measure blood pressure using a blood pressure machine and state what step to take if the number is high. What is hypertension? Hypertension is the force of blood pushing against the arterial walls of your blood vessels at a consistently high rate. It is also referred to as high blood pressure. That is according to What is High Blood Pressure 2024. So I'm going to be using the term hypertension and high blood pressure interchangeably. Blood pressure ranges. According to What is High Blood Pressure 2024, blood pressure are arranged into different categories based on the numbers. A normal blood pressure is ranged at less than 120 to over 80. What do I mean? When you take your blood pressure, you have two numbers. One is on the top, one is on the bottom. So the top number is called the systolic and the bottom number is the diastolic. For normal blood pressure, the top number is the systolic is less than 120, and the bottom number, the diastolic, is less than 80. An elevated blood pressure will run in the range of 120 to 129 for the systolic and less than the 80 for the diastolic. A high blood pressure stage 1, or what is also called prehypertensive. The systolic runs between 130 to 139, and the diastolic runs between 80 to 89. Now, the high blood pressure diagnosis, when you are officially diagnosed with high blood pressure, that means that your blood pressure runs 140 or higher for the systolic, or over 90 or higher for the diastolic. This is stage 2 in the category. Hypertensive crisis is when your blood pressure is higher than 180 for the systolic and or higher than 120 for the diastolic. This is an emergency, and you need to go to your doctor immediately or go to the nearest emergency room. Signs and symptoms of high blood pressure. Not at all 2022 listed these symptoms as few of the signs and symptoms for high blood pressure, including headache, neck pain, nausea, vomiting, new onset blurred vision, weakness, fatigue, confusion, and mental status changes. High blood pressure is often referred to as the silent killer because sometimes individuals do not experience any of these symptoms listed or any symptoms at all when the blood pressure is extremely high, which can be dangerous. That is according to What is High Blood Pressure 2024. Risk factors associated with high blood pressure. According to NAT et al. 2022, high blood pressure can be classified into primary hypertension and secondary hypertension. For primary hypertension, the cause is often unknown, but it can be associated with family history of hypertension. So if any of your family members, maybe your mother, father, got high blood pressure, there is a possibility that you may get high blood pressure. Age, so the older you are, there's a higher chance of you getting high blood pressure. Black race, that means that African Americans are a higher risk of developing high blood pressure compared to other races. Sedentary lifestyle, obesity, poor diet, increased sodium intake. Taking too much salt puts you at risk for getting high blood pressure. Smoking can also put you at risk for high blood pressure. Excessive alcohol intake can put you at risk for high blood pressure. Other diagnoses can also put you at risk for high blood pressure, such as diabetes mellitus or coronary artery disease. Secondary hypertension can be caused by other underlying conditions that can increase the workload of the heart. Complications of high blood pressure. According to Metcalfe 2024, hypertension can lead to stroke, can lead to heart attack or heart failure. You can develop chronic kidney disease or blindness, and so on. Lifestyle modification. Hypertension can be managed with medications and other measures, including physical activity. It is important to be physically active in order to decrease to decrease the risk of developing high blood pressure. 30 minutes walk every day is okay to help decrease your risk for developing high blood pressure. Smoking cessation is another way of decreasing your risk for high blood pressure, since smoking is a risk factor. Eating a healthy diet, according to the American Heart Association 2024, can decrease your risk of getting high blood pressure. That is, looking at this chart from the American Heart Association, they want you to have fruits in proportion. If you look at a table, they're cut in a percentage of proportion. So you have fruits. They want you to add vegetables, get your protein, your greens or your carbohydrates, and your dairy in a combination. Not too much of one item. Stress management is another good way of managing or decreasing your risk for developing high blood pressure. That is according to the American Heart Association 2024. Medication compliance. That means take your medication the way your doctor prescribed so that you don't develop high blood pressure. Or if you already have high blood pressure, and you're taking high blood pressure medication so that you can decrease the risk of developing complications that were listed that I mentioned earlier. Regular follow-up visits. So keep your doctor's appointments. Keep your follow-up appointments with your doctors. It is important. That is according to the American Heart Association 2024. Measuring blood pressure. So this part of the lesson is you at home, you buy your blood pressure monitor, and you want to start checking your blood pressure regularly. According to Home Blood Pressure Monitoring 2024, it stated that you should buy, make sure the monitor that you buy is validated and accurate, meaning it's calibrated so that the reading will be correct. It will give you the right reading. Choose the right cuff size. The cuff must fit properly. If it's too large or too small, it will give you an abnormal reading. It will not be accurate. So once you have that, and if you're not sure how to calibrate your monitor, you can either take it to your provider, to your doctor, or to a pharmacy where you bought that from, and they can check it to see if it's calibrated or calibrate that monitor for you. How to use the monitor. So you finally got the monitor, you home, and you have decided you're going to check your blood pressure. Plan ahead. Do not exercise. Do not drink caffeine. Do not smoke within 30 minutes prior to taking your blood pressure. You want to go to the bathroom and empty your bladder. You want to allow at least 5 minutes of rest before you take your blood pressure. So you sit down, wait 5 minutes before you begin taking your blood pressure. You want to sit still with your back straight and supported. So get a back rest. Sit in a chair that has a back rest. Do not cross your legs. Place your feet flat on the floor. Support your arm on the flat surface. So the arm that you're going to have the blood pressure cuff on, you want to support that arm on a flat surface. And then you can take the blood pressure. What to do if the number is too high? As I mentioned earlier, hypertensive crisis is when your systolic blood pressure is higher than 180, and your diastolic is higher than 120. So if you took your blood pressure and you saw a number within that range, you should stop. Don't be alarmed. Go to your doctor or go to the nearest emergency room and seek help immediately. Thank you for watching and thank you for listening. But before you go, please take a few minutes to answer my 5-question quiz listed below and put your response in the comment section. Thank you.